Welcome to Accent Your Beauty. Dr. Berkowitz and I have a really good show for you tonight. We have Jen with us, and Jen, you've got a great story to tell. So many people in this country, men and women, have problems with acne, and it holds you back. When you don't feel you look good, you don't perform as well, and you don't have as much confidence. Tell us your story.
So about 2 years ago, I met Dr. Berkowitz, and I've always kind of suffered from acne scars, and it's always been, I think, my biggest insecurity. I hated going outside because I hated when the light would shine bright on my face, because that's all I would notice and think that that's all people would see. So I talked to Dr. Berkowitz and Maria, and they set a nice little plan for me, and I wanted to do something like crazy. I'm like, just burn my face too, whatever, but Dr.
Well, did you have acne as a teenager?
I did. I suffered from cystic acne, and it is something I dealt with almost my whole life.
Yeah,
so.
and what ends up happening is these cysts end up breaking down the surrounding tissue.
And that's why you have those little
Right.
divots?
You get the little divots, and then you get scar tissue that forms too. So we end up putting together a plan that can take care of not only the divots that are there, but give back some of the volume that's lost too. But we can take a look at your pictures, what you looked like beforehand. And you can see, the scarring that she had that really started from her temple into her cheek and into her jawline as well. And let's look at another view. And you can see at this angle, even more how it's, taking its toll on her cheek as well.
So she had it more in the cheek area. I see her forehead looks pretty clear.
Mm-hmm.
Yeah.
So it was mostly
Right
in
here.
that area right there.
And I think we have one more view. And so again, and acne scarring, it also depends upon the lighting, how much you can see the scarring that's there. So, when I met Jen, she was definitely impacted by the scarring that was there. And so we put together a plan. And what I say is that the plan, when we put it together, it's additive. That, 1 + 1 + 1 doesn't equal 3. It can equal 7 or 8 in regard to the changes that we can make over time. So we put together a plan of a product called Bellafill, which is a terrific product, the first FDA filler that is formulated just for acne scarring, and also happens to be the only FDA filler that is approved for greater than 5 years. And when they did the 5-year studies, they found that not only does it last 5 years, but it was actually found to be the safest of all the fillers that are out there as well.
So you actually go in and fill the deeper cavities in the skin, the deeper crevices.
Not just the deeper ones, but you end up losing volume, so I actually will fill in below that area too, so within the cheek too. So I go directly into the scar and below the scar as well. And I perform something called subcision at the same time, which is basically taking the scarring that's there and breaking down that scar. And this is all done within the office itself. Do you remember any discomfort or?
No, I actually enjoyed it and hearing the pops.
Okay,
I did.
That's interesting, because I know people that are frightened to death of MRIs, and I love going in there and hearing the clang, clang,
Yes.
click, click. So you do get used to certain things, and it doesn't bother you at all.
No.
So you had no pain or discomfort
No,
with any of the treatments.
I was very nervous at first, but once he started and you hear that little tuck, tuck, I'm like, oh.
Yeah, so you hear it but not really feel it.
Not at all.
Yeah, so basically the scar tissue that's underneath, that's pulling down at each one of those little acne scars, needs to be subcised or broken, if you will. But if I did nothing else, it would just reconnect. And so I use the filler Bellafill underneath that area. So we'll actually show video later during the second segment of my placing the Bellafill for Jen.
Now, when you leave them and you don't do anything, doesn't the skin naturally stretch as you get older and the scars get bigger?
So what ends up happening as you mature, you actually lose volume within your face, and it actually makes the scarring look worse because of the fact that now that volume that's pushing out on the cheek has retracted back, and you get a further pull within each individual scar. And so this was a perfect time to, fill in for her with the Bellafill. But we also used microneedling and a laser on her skin too called PicoWay to help build up the collagen for her as well. What microneedling does is the microneedling, and we were laughing before because she was saying how she's addicted to it, that she loves the way her skin looks afterwards, is that with microneedling we're creating little channels. And those little channels, they help to build collagen, but they also allow us to place product within that area, whether it be specific products for the healing or her own blood. So we've spoken about the vampire facials.
Facial, right.
And so with your own blood, you get the healing, and you get this healing cascade that comes about from the platelets that have growth factors.
Which is that PRP, right?
That is PRP, or platelet-rich plasma. So we combine that too. So that's another step that can be done. And Jen's had both microneedling with the platelet-rich plasma as well as some products too.
Now, when you don't do anything, is it prone to forming blackheads and bacteria and things that get caught in those holes?
So, if somebody has active acne going on at the same time, then we really want to treat the active acne first, get that under control for them. And so that is something that we try to do before doing some of these other procedures. And that can be done with products that they can use at home, or light therapy that we have at the office too. And even, with the microneedling that we do a specific one called Venus Viva. Venus Viva, the beauty of it, is microneedling that actually use radio frequency. And what radio frequency does is it creates heat to build collagen, but it also helps to kill bacteria at the same time.
That's what I was thinking was a factor with acne, is that it's prone to either cause bacteria or bacteria causes the acne. Is acne caused from what you eat, or is it caused from your sebaceous, oily glands?
Yeah, so as you said before, it's related to bacteria. There is a bacteria P. acnes that's on many people's skin and doesn't cause a problem, but for some people, it causes these outbreaks. It ends up blocking the sebum from leaving the skin, creating the acne, and then when it gets cystic acne, you have these larger marks that are there, and then creates these scars that can be rolling scars, meaning you put your finger on them and they roll away, or box scars that basically look like a boxcar from a train that they come about.
Really? Were you a picker? Did you pick when you were younger?
I probably did, yes. And then
Because picking, they say, leaves bigger scars.
Yeah, so also you can get these, what's called an ice pick scar, where it looks like somebody's actually put an ice pick into your skin to cause these scars that are there. And they're very hard on both men and women, especially when are they coming about? They're coming about when you're 15, 16 and just getting ready to go out to the world, to show yourself to the world, and it's cruel, and that's when acne starts coming on for most people. And then the scarring starts if it's not,
Did your acne stop when you got out of your teenage years, or did you have adult acne also?
I had adult acne. I had to go on Accutane in my 20s.
And did that help?
It helped eliminate the acne, but it didn't help with the scarring.
So you were able to eliminate the problem,
Right.
but not fix the scarring that
Correct.
was the residual.
Correct. And like
of
you
that.
said, when I was younger, my face was fuller. I didn't see them as much, but as I got a little older, lost some weight, they really stuck out. So
And it's really hard to cover with makeup.
it makes it worse
because it makes it
sometimes.
worse.
Yeah.
Any kind of a foundation kind of accents it. And often I notice when people put blush, if it's a creamier blush,
Or a shiny.
it shows it more, right. So how did you start out? What was the very first thing you did when you met Dr.
Bellafill.
Berkowitz? Okay, so
was
that
the
was
best,
step
yes.
one.
Yes.
Yeah. So she did Bellafill, and we'll show that. But what I'd like to show first is a Venus Viva treatment, and to
Good.
just show how comfortable
Let's
that
take
is,
a
and
look
that's
at
using
it.
those radio waves. So this is actually a 20-minute treatment that we sped up to show, and basically that handpiece has these microneedles in it, and the microneedling is what's creating the redness to the skin at the time, and then with each time the energy is placed into the skin from the radio frequency, helping to build collagen, kill bacteria at the same time. And then you can have PRP or platelet-rich plasma placed afterwards. And so let's show the next video, which would actually show a vampire facial. So the vampire facial is actually quite relaxing. So with it, we're creating these channels, whether it be with microneedling or with the Venus Viva, then placing PRP or platelet-rich plasma on the skin, giving that healing cascade to the skin, giving the peaches and cream look to the skin. And you know, Jen basically said, you know, she's addicted to that now.
So none of that hurt? None of the
No.
various processes and procedures had any pain involved with it? The vampire facial, when they rub it on, it looks painless.
Right.
But then the part where they actually use the needling.
So the microneedling, we can go to different depths, and you don't have to necessarily go deep with it, but we can. And so depending on what the person needs, I can, you know, go to a depth that with it, I need to do it in the operating room to help relax them with an anesthesiologist, but it's very few people that need anything along those lines. Most people, we're going to a depth just to create these channels enough to sparkle the skin, to create that peaches and cream look to the skin, to help with build collagen as well.
Well, let's talk downtime, because you're talking several different procedures.
Right.
Which was the most downtime for you where you had to actually take a few days and be home?
The vampire facial, not ever be home.
Uh-huh.
I actually worked right after. But if you're downtime for me is not wearing makeup or
Right,
something.
right.
So that's downtime. But nothing, I didn't need to stay home for any of it.
Okay.
Yeah, and the reason you can't wear makeup is because we're creating these channels.
You don't want to
Your
put
makeup can have
into-
bacteria
Right.
in it, and so we want these channels to close down, and that usually takes around 24 hours for most people.
So a couple days of no makeup.
A couple days. Yeah.
And you're beautiful anyway, so I'm sure no one noticed the
That's sweet.
difference. And what else did you do? I know you said that you've had the hydrofacials, which we love. Hydrofacials are
Yes.
wonderful. And what else do you
The
do on a
Pico.
regular basis?
I've done the Resolve.
So she did the Pico Way Resolve, which is the same laser we use for tattoo removal, but it goes directly to the skin and can cause the same beautiful changes of building collagen as the CO2 laser. And the CO2 laser is one of my favorites, but the CO2 laser, there's downtime. The beauty of this Pico Way Resolve treatment is it goes just below the surface, so it leaves that top layer to help in the healing. And so you get the benefit of building collagen without any downtime at all.
Yeah.
It's pretty amazing.
Is that the one where the results aren't immediate? It takes a little bit of time for it
So
to show?
actually all these treatments, the results are not immediate.
Even with the vampire facial?
Even with the vampire, it takes time. The hydrofacial, your skin is going to feel fantastic right afterwards, but the benefit still takes a few days before everything builds for you. And I'd like to show a video of the hydrofacial. I feel it's like the Rolls Royce of facials.
I love it.
And this is the Hydrofacial. It is the Rolls Royce of all facials. It uses special serums to penetrate into the skin quicker at the rate than you would to get a regular facial. It uses different levels. So first you have an exfoliation, a mini chemical peel. It infuses your skin with very good antioxidants. It also extracts and gives a good hydration. So you leave the clinic looking very, very, very smooth.
So the hydrofacial, first of all, it's just so relaxing. Then afterwards, you can both see your skin glowing, feel the skin, it just feels fabulous afterwards. And that's not even the full benefit. The full benefit's actually coming days later as it's helping to turn over the skin, exfoliate the skin. And some people have fun just right at the end looking at the little capsule that
was me. That was me.
shows the collection of
That was me.
all the
I
impurities.
wanted to see what came out of my face. After my first one, I was hooked, and I said, just put me on a regular monthly program. I will be here once a month for my hydrofacial. And looking afterwards to see what was sucked out of your pores was the most fun of all, because you got to see what was really on the surface of your face that you don't get off on your own just by cleansing. And I don't care what kind of cleanser you use, you can't get as deep as the hydrofacial.
I agree.
Yeah, the hydrofacial is just a wonderful, treatment that I feel is worthwhile, once a month, once every 6 weeks. And not only does it help to maintain, but if you are consistent with it, you're going to see improvements in your skin, whether it be from acne or from other impurities. We can customize it to whether it's a problem with pigment for you, aging, wrinkles. These are all things that we can work on with the hydrofacial.
Well, a lot of things that happen as your skin gets older, it gets thinner, the wrinkles show more, you get the age spots. And I found that after my hydrofacial, everything was just so bright.
Plumpy.
And it just my skin looked so much younger than my age. And I thought, wow, this is something I'm going to do on a regular basis. And now I have several friends lined up to do it as well. How often do you do it?
The hydrofacial every 2 weeks.
Every 2 weeks. The cost is very affordable.
It is
Actually, it's a very affordable facial.
I love it.
I
think anytime you have something to do or an event or something, it's one of those things that gives you that instant gratification. So I love it.
It is. It's wonderful. Well, when we come back, you're going to really watch a procedure done. For the whole segment, you're going to see
a Bellafill treatment on Jen.
You're our model.
Yay.
So we'll be right back. And after the film that we see, we'll be back with the next segment. We'll see you in a few.
As a business owner, you're always looking to save money and cut costs where you can. And if you advertise on radio or television, you know it can get pretty pricey. If radio and TV aren't delivering like they promised, and you're looking for a more reasonably priced way to get your message to the masses, I've got an answer for you. New Radio Media. With live streaming and on-demand programming, your message can be seen throughout the day, and you can worry a little less about cutting those costs. For more information, go to newradiomedia.com or call Buzz Van Houten at 248-939-9999.
Low budget movie version.
60s TV version. Early 2000s high school pseudo-adaptation that eventually grows into the geek we all know and love version here. I'm getting paid a lot of money to be here, so listen up. Watch the Geektainment channel on newradiomedia.com. It's geek approved. It's all about you, and that's the way we like it.
Where you're going,
What you do to stay fit,
what you're eating,
what you're thinking,
and how you're feeling. Join the conversation at newradiomedia.com's Lifestyles channel.
stream the life you want to live.
Detroit,
It's the home of some of the world's most talented artists. It's where techno and Motown were born. It's a city where you can experience raw, untamed rock and roll. I'm Ben Rose, and I'm inviting you to join me weekday afternoons from 4 to 5 for the Motor City Juke Joint. I'll have interviews with musicians, info on what's going on around town, and a playlist curated by me just for you. It's all right here on newradiomedia.com.
Doctor, my eyes have seen the years and the slow parade of fears without crying. Now I want.
Hello, I'm Dr. Berkowitz, and we're here at Accents Cosmetic Surgery in Sterling Heights, Michigan. We also have an office in West Bloomfield as well, and we're excited to show you a behind-the-scenes look at a Bellafill injection. Bellafill is made by Suniva. It's one of my favorite products for enhancement and for fill. And today Jen is here with us. Do you mind if I tell everybody your age?
Yes.
You
No,
mind?
I don't mind.
So she's 37 years old, 37 years young.
Yes.
37 years young. And we're going to do a Bellafill injection today. We're going to stay along with what the FDA states, which is basically it's an injection for the nasolabial fold, which is the fold right in the area over here as well. And that's probably the number one area that patients request all the time. Have you had filler before?
I sure have.
So in the past, what filler have you had? Any of the, you don't have to name it, was it one of the short-term fillers?
Yes.
And so were you happy with that?
No.
No. So as far as the short-term filler, did you like the look, or was it something else about the filler itself that you weren't happy with?
You know what? I think it's a combination of both. It was more the look. I like something a little more structured, kind of like what the Bellafill does.
Okay.
And the fact that it didn't last that long.
So the other one didn't last as long as you'd like.
No.
Yeah. So the beauty of Suniva is this company went a step further than other companies. Most of the other companies looked at fillers and they said, you know what, we've proven that we lasted a year, and they stopped there. But Suniva put a lot of time and energy and financing into looking at the filler, and they went to the FDA and they said, we want you to look at us not just for a year, but let's look at it for 5 years. And they proved that at 5 years the filler was still working, which is pretty amazing. So I like to think of it as you're going to own this filler, you're not going to rent it, and so we're not starting from ground zero year after year after year. What do you think about that? Yeah. And so we've actually used some Bellafill for you before today, and so the other indication for Bellafill is for acne scars. And so you had some acne scarring.
I did.
And you're smiling now. and why is that?
Because I'm really happy. It's changed my life, and that's really the truth. So yeah.
So the scarring before, you were saying you didn't really feel good about yourself.
No, not at all. I was very insecure, and now it's like, yeah, it's life changing, really.
So this is what, through my talent and through Bellafill, what we can do is to, build up scar tissue that's there and to give a very natural and soft look. And so that's what we're going to do today. We're going to further enhance, and we're going to go after this nasolabial fold that's here. So Jen's a perfect candidate for this procedure. Number one, she's tried other fillers, and with the other fillers was disappointed at their longevity. Number two, she has had some scar tissue from past acne, so we were able to build up her cheeks, and so she can't stop smiling now when she looks in the mirror because of her cheeks. And she is someone that is going to get the long-lasting effect from this filler. So the fill you're going to see right away is the fill that within, let me show you a syringe. So within the syringe itself, what we have here is in this solution, it's 0.8, a little bit more cc's. 0.2 of it is what's called PMMA, which is the secret sauce, if you will. And what that does is that builds a matrix of your own collagen. In it right now is collagen itself too. So part of this is collagen, and so I'm injecting that collagen, and that gives you that immediate fill, so you can see what the result is right away. You may have some swelling, and it's possible to have some black and blueness that may make it that it's not the true end effect, but you'll be able to see an improvement. And then that, your own body will break down over time. And then the PMMA will build this matrix of your own collagen, and that's the beauty of it. And this company is pretty amazing. I went to their factory, and it's, first of all US product. And what they do is actually they take the time where the syringes are hand filled. And you know, most other companies, it's basically they're putting through machinery, but these are checked and by hand every single syringe, which is quite impressive as well. So we're going to get started. We're going to cleanse your skin. Josh, if you can start cleansing the skin, I'll get this syringe ready and I'll explain to you everything that we're doing throughout. Do you have any questions?
I don't.
All right. So although we've already done a cleansing, we're going to do a little bit more. We'd like for all the makeup in that surrounding area to be gone. And we had your icing beforehand, but that's all that we've done as far as, you know, numbing the area. Is just really to use ice. But we're going to go an extra step, and I'll show you that in a moment. Get these gloves on. There we go. So this little vibratory device, we're going to place right onto the area for you. I'm going to turn your head. Good. And bring it down a little bit. And so I'm just going to place that. Good. Actually, let me bring it back just a little bit further. You know, I know, Jen, you take Motrin at times, so sometimes she may get a little spot of bleeding, but this now is helping it with any discomfort. And so we're just going to place right within the area here. And so what this does is, number one, we've placed a little bit of filler. Now the filler, besides the collagen within it and the PMMA, has a little bit of lidocaine in it. So that starts to numb this area. So the numbing's already begun, and that makes the procedure more tolerable for you. And I'm just kind of massaging that in for you. How are you feeling so far?
Fine.
Good. And then we're going to turn for you. Smile for me. Good, relax now. And here we go. You may feel a little bit of pressure. And so I'm going right under the skin surface, and I can see where I'm placing. And I'm just kind of fanning out small amounts within this area. Now right now I am using a needle, but I do use cannulas as well. It depends where I'm placing. So when I'm placing in the cheek area, to build the cheek, I usually use a cannula within that area itself. And so far so good. Now this is what's called an on-label, meaning the FDA has approved this, but as physicians we can use it off-label as well. One of my favorite places to use this filler is right within the temple area. As we mature, we lose a lot of volume within this area, and so building up that area is beautiful. We've already built up Jen's cheeks, and they look terrific as well, but we can also develop the jawline as well. I can also give a little bit of a lift to the brow too, but we're already seeing a nice improvement within that nasolabial fold. So from 0 to 10, 10 being the worst pain you've ever felt, what would you describe this as?
3.
3, okay. And so you can see that little bit of Motrin makes it that she has a little bit of spotting that's here, but I don't expect any kind of black and blueness along those lines. And here we go again. And I'm just fanning out throughout, so it gives a very natural flow between the cheek area and the lip area. And we're going to change the position, but first just hold some ice right here, and that will stop that little pinpoint bleeding that you're having. So, by the way, if you have questions, we're here to answer any questions for you, either through Facebook or feel free. Consultations are complimentary. Come on in, and we're doing a special promotion with Suniva for Bellafill this month. We are actually taking the $500 off of the full kit. And this is actually our month in March that we do a nickel promotion. So we're making that even better, and what we've done is not only take $500 off, but you're going to get a 6th syringe for only a nickel. And we've never had pricing that low for such a great product. And if you ever were to look at the fillers that you may use that go away or disappear within a year, if you add up what you may be spending on those fillers, within a year's time, if you're using Bellafill, you're ahead of the game. And so financially, it makes a lot of sense to use this product too. Also, if you're on Facebook, please take the time to like us. That way you can learn about some of the other things that we're doing. But let's take a look and see how Jen is doing here. And let me just get an alcohol pad. So I want to place a little bit more in a moment, but I want to show you where we're at, because things look quite nice. Take a look.
Good night. Oh, wow, it looks so good. Sorry.
It's all right. We're happy that you're happy. So let's just place a little bit more for you. Good turn. And then make you a little bit. Beautiful. And if you open your mouth for me, hopefully there's no gum. I'm just going to gently massage that area for you. And so what I like you to do with this filler is I like for you to ice over the next 24 hours. And after 24 hours time, you don't need to ice anymore. But what I do like you to do is to take 2 fingers 2 or 3 times a day for 2 or 3 minutes and just gently massage along that area. And that helps to bring down any kind of swelling a little bit faster for you. Okay, but let me show you one more time. Take a look. And then we'll do the other side in a few moments.
I knew where I was going to.
So we are all done for now. Again, please like us on Facebook. We're happy to answer questions about Bellafill and this great product. I really think it's life-changing for a majority of my patients. Either the ones who have had all these fillers that constantly are coming back and they get tired of being injected over and over again. And now they can have a filler that's going to last them years to come. And then people like yourself too, where it's life-changing because of the changes we can make in regard to the acne scarring as well. So thank you so much. Like us on Facebook. We look forward to seeing you. We look forward to taking great care of you as we do with our other clients. Have a great night, and hopefully the snow's not too bad for you. Take care.
Advertising your business these days can be challenging. Traditional radio and TV ads are expensive and, frankly, a bit of a crapshoot. Not to mention, the audience for over-the-air material is shrinking as more and more of us demand to see and hear what we want, when we want. Advertising on new radio media is a solution. With our live streaming programs that are also available on demand, your message is always ready when your customers are ready to watch and listen, all for a fraction of what you'd likely have been paying for other ads. NewRadioMedia.com. Call Buzz Van Houten at 248-939-9999 for more information.
It's all about you, and that's the way we like it.
Where you're going.
What you do to stay fit.
What you're eating.
What you're thinking.
And how you're feeling. Join the conversation at newradiomedia.com's Lifestyles channel.
Stream the life you want to live.
Do you want to see things like this?
Did you just say you died?
Well, I mean, technically.
Or maybe even something like this. We'll do nothing but destroy your corpses and burn them all for my dogs. Your dogs are gone.
And sometimes, a little of this.
We need to have a talk. I take my axe and I smash it. No!
And check out Podquesters, the show where we tackle ghoulish goblins, fiendish foes, and dangerous drakes.
Oh, like the singer?
No, the dragon creature. Anyways, Podquesters, Fridays, only on newradiomedia.com.
Hello, I'm Dr. Mark Berkowitz from Accents Cosmetic Surgery in Sterling Heights, Michigan, and I specialize in cosmetic surgery. I am thrilled to offer Bellafill in my practice for my patients who suffer from acne scarring. Bellafill is the only dermal filler on the market approved for the correction of moderate to severe atrophic distensible facial acne scars on the cheek in patients over the age of 21 and has been proven safe and effective through 12 months. Acne scarring is a widespread issue and can have deeply emotional impact on those who suffer from it. I love using Bellafill because it gives my patients natural looking and long-lasting correction for their acne scars and helps them begin feeling more confident about their skin. So, the last segment, you saw Jen go through the Bellafill injection, and she did great to the point that she's had a few injections, and it's really, I mean, this 2-year course has made unbelievable change.
Oh, I can see. I mean, you're radiant. Your skin is glowing.
Thank you.
Now, if you had to go back and kind of describe all the things you've done, it's probably hard to keep track of everything in 2 years.
I have it all.
But what you started out with the Bellafill, and then what?
We did the Bellafill, and then after the Bellafill, we did the Pico Way Resolve, and then after that, we started doing the microneedling, which I'm obsessed with. I do that at least once a month. We've done a few peels. As far as that's part of my skincare, but I've done other things too. So.
Now, obviously, because you work with the doctor and you get a, family rate, discount rate. Doc, what would everything that she's had done in a 2-year period, offhand, if you had to add it all up in your mind?
Well, first of all, we are very conscious of the costs for people coming in, and so we package, and so we put together a plan, and we realize where these costs are. We offer 0% financing as well. The average person will spend for Bellafill, which again is a long-term filler, somewhere between probably $3,000 and $4,000 for Bellafill.
Right.
And that lasts for a couple of years?
Honestly,
5 years plus.
Okay,
Plus.
so you had that done and you do not have to do that again for a while?
I don't have to do it for a while, and I actually noticed he did put some in my cheeks as well, and he did tell me that I'll start noticing it build up throughout like the years and whatever, and he's right. I feel like my cheeks are getting nicer as
Yeah, I mean, all the other fillers, you're renting them.
Yeah.
And Bellafill's the only one that you own this filler. And we know that it lasts 5 years. I truly believe it lasts a lifetime. And it's something that we can build a foundation with, and you may lose other volume that you would have lost naturally over time. All the other fillers, we're going to start from ground zero year after year after year. But with Bellafill, we can build upon what we've already done for her. That's the beauty of it.
So back to the
So back to
cost
the
of
cost.
everything,
So
so we added up.
So, and then the vampire facials, we will put together, usually, a single one can run between $1,000 and $1,800, but we put together a plan where people are having usually 2 or 3 of them with the Bellafill, with the laser. It's going to run somewhere, over a 2-year course of around between $3,500 and $7,000, depending on the things we're doing for you.
That's not bad. I mean, to go from what we saw in your before pictures to how you look now, I mean, it's so well worth it.
It's worth every penny.
Has it changed how you feel about yourself and your self-confidence?
Yeah, absolutely. And that's why I was like, Dr. V, I must love you for being here, because I would never have been on camera if this was 2 years ago. So, yeah, of course, the way I talk to people, when people are looking at me, it's changed my life a lot.
And I'm sure you get a lot of compliments, people that comment on how beautiful your skin is. And that has to sound crazy to you after having acne for so many years and hiding your face.
Right.
Now
so
to
now
start
people
getting
say, "Oh my God, your skin is glowing!" Like what? Like, "Oh my God, you have amazing skin!" And I think that's the biggest compliment someone can give me right now, and it's actually made me tear up a few times because it is something that I didn't hear in the past, and to hear it now, it's.
And it's interesting. People who end up seeing her skin, Jen has sent other people to us because they've seen her skin and they ask her about her skin, and she talks about the changes we've made, and other people now can come to us because of that as well, because they've learned of the changes that she's made.
Now, what happens if your acne were to reactivate?
I still will every once in a while.
Do you get flare-ups?
I do. Not as bad as I did as a child, but now that I've been doing the hydrofacials and the microneedling, that's maintaining my skin as well. So I still have pores, but they're not as large as they used to be. So that's.
Now, does that have to do with the fact that because acne is at least exacerbated by bacteria, when you constantly clean your face and do all the hydrofacials, you're not giving the bacteria as much time and place to grow?
Well, you're treating the bacteria as well. So with the peels and with the heat as well, you are getting rid of the bacteria that's there. You're changing the flora of your skin. And so by doing that, you're creating a healthier environment for your skin as well. And besides Jen, others have really done well with Bellafill too. So I'd like to show another video of a patient who was quite happy with Bellafill.
Started getting really big cystic acne when I was 14 maybe, and then I've had it until last year, actually. Like big bouts of it, and all the different medications, all the different topicals, everything I've taken. And finally I get it under control, and then I had scarring, so I was like, once you get it all out of the way and then you have something else on your face, you're like, what can I do about it? So my acne scarring affected my confidence entirely every day. I felt like people were only gonna look at my face for my scars, or I would sit on certain sides of people so that they couldn't see it. Just like I was just aware of my face all the time, and it was tiring, and you feel badly doing that, and you get distracted. I gave up. So I tried Bellafill, and I went in to the dermatologist, and they put little injections, took 20 minutes maybe, and within a week, I started seeing a smoother complexion. And your face is a little sore at first, but it's like worth it entirely because you're used to sore faces from acne. But I feel it's smooth. It's smooth, and it's my face, and all the skin feels the same around my whole face, which is awesome. And you don't feel it in your face. You forget you've done it until someone's like, hey, your skin's like really good. I instantly felt more confident and more beautiful, and didn't even put makeup on. I didn't have to be constantly like thinking of covering myself. I was just being myself. It was like this whole weight lifted off my shoulders. And you can just enjoy your time with other people and not worry so much about what they're seeing. Bellafill has definitely been a life changer.
I want to add something that I think is very important. I've learned so much from Dr. Berkowitz. I'm getting to be a little encyclopedia of skincare. But after any of these treatments, it's very important to watch how much sun you get and to use your sunscreen, correct?
Well, it's very important because, number one, the sun's rays can break down collagen for you. And so people who lay out in the sun, they may like the look of the tan now, but they're going to be so unhappy 15, 20, 30 years from now when their skin breaks down faster than their friends who protected their skin throughout. Plus, it can lead to pigment problems too, especially in somebody that has acne. And so part of the problem becomes when somebody has an acne flare, you're not just looking at the scars that are there, but you're looking at changes in pigment too. And so that's part of what we work at, is to improve the overall pigment, not just the scar marks.
Well, I think tans are very 80s. You know, they kind of remind me, they were so 20th century when everybody thought it was so cool to be so tan. And now that we're all from that tan generation getting older, we realize how much better it is to have smoother, lighter skin. So, and we're not even covering the skin cancer part of it, which so many people in my age group, the baby boomers, who laid out with baby oil and iodine and baked with reflectors.
And they're paying the price later in life. It's
Yes.
unfortunate, but
That's so true. That's why we have to spend so much time and money undoing what we did to ourselves unwittingly because we thought it was so healthy.
but luckily there are treatments now to turn back time from sun damage.
That's what we love about you, Dr. Berkowitz. We can come to you with age spots, wrinkles, acne, and you fix it. You're like a miracle man.
Well, I appreciate that. It allows me to be happy myself to make others happy. So
And when
I
you
love
see
it.
people coming in and they're so happy with their results, and then they bring other people in, like you said, you know, after my hydrofacial, I had all these girls saying, sign me up. And so it is addicting. You like feeling good. And the more you feel good and the better you look, it's like a snowball effect.
Absolutely.
So I'm sure that a lot of your patients are repeat patients, correct?
So not only are they repeat patients, but they, just like Jen, send in their friends and family as well, or people they just walked into the mall and asked them about their skin, like with Jen. And you can show some more people that have had
Let's
acne
look at some more
treatments
before
and
and
the changes
afters.
that have been made. So this gentleman, you can see the scarring within the lower cheek area into the chin as well. And you can see this is using Bellafill to build up that collagen for him. And it makes a dramatic change. Let's go to the next picture. Again, the scarring along the cheek area and the pigment changes. And not everybody can you make it disappear 100%.
I
But
was just going to say that some cases are so deep that you actually can't make it go completely away, but it's a significant improvement, much better.
yeah, and at the consultation, I can let somebody know, you know, this one treatment may make a change 10 or 15%, and these 3 treatments may make a change of 50 to 60%. But I have a good guide to let you know before you even start what changes to expect. Let's see the next set. And again, smoothing out of the scars that are there. Next. And do we have one more?
Oh, wow.
Yeah.
Yeah. So again, you know, everybody has scarring that's different. Everybody sees themselves differently too. And so for some people it's magnified what they see, and whether it's one scar or unfortunately a whole face of scars, there are things we can do to change that and change their lives for the better.
So there's really nobody that won't get improvement, at least to some degree.
We have a treatment for somebody. All the treatments may not work for everybody, but I'm not a cookie cutter. I can customize a treatment for people, find out what's going to work for them. Listen, my name is on their faces.
Right.
And so I only want to put them in treatments that I know are going to work for them.
And I think a lot of it has to do with realistic expectations.
Mm-hmm.
So I think that's one of the things I like most about you, is that you sit down with people and you give them an honest evaluation of what you can do for them
Mm-hmm.
and what they can expect as a result. And sometimes it's not done in one treatment.
No.
Sometimes you have to come back
Mm-hmm.
a second or a third time to get the results that you want.
Yeah, education is such an important part of the procedure because I want people to know what's going to happen throughout. They know what to expect, when to call me. And as a matter of fact, even if they're not sure, they have my phone number. They can call me and we can discuss what's happening with
Well,
them.
that's the beauty of working with you, Dr. Berkowitz, is that you're real and you're genuine and you don't paint a picture that's unrealistic so that people are disappointed when they don't get what they thought they were getting. Anyways, we'll be right back and take a look at some more celebrities. We'll see you in 2 minutes.
What's going on in your neighborhood?
They say it takes a village.
It's the simple things.
The things that are a testament to the old.
And the things that are a testament to the new.
Know what's going on in your community.
Check out our community channel on newradiomedia.com.
It's all about you, and that's the way we like it.
Where you're going.
What you do to stay fit.
What you're eating.
What you're thinking.
And how you're feeling. Join the conversation at newradiomedia.com's Lifestyles channel.
Stream the life you want to live.
Do you want to see things like this?
Did you just say you died?
Well, I mean, technically.
Or maybe even something like this.
We'll do nothing but destroy your corpses and burn them all for my dogs.
Your dogs are gone.
And sometimes, a little of this.
We need to have a talk.
I take my axe and I smash it.
No!
And check out Podquesters, the show where we tackle ghoulish goblins, fiendish foes, and dangerous drakes.
Oh, like the singer?
No, the dragon creature. Anyways, Podquesters, Fridays, only on newradiomedia.com.
Hi, I'm Art, and we're the crew at Tuffy Walled Lake. We've been in Walled Lake for 20 years, and through our knowledgeable staff and customer satisfaction, we've become quite the cornerstone in our community, and to our discerning customers statewide. We know how important your vehicle is to you, and we take pride in our impeccable, affordable service, and we're trying to get you back on the road as quickly and safely as we possibly can. Please stop in and see why everybody comes from all over to get their cars serviced at 784 North Pontiac Trail in Walled Lake.
Yay, this is my favorite segment with Cali, and we get to see all the famous people and what they've had done. This is my very favorite. So who we got tonight?
I love being here. The first one we have is Gigi Hadid. Very iconic fashion model. And as you can tell over the years, you know, signing modeling contracts, she's definitely had to change her facial
Over
features.
the years, she's like 20.
Yeah.
21. Over the years since she's 16.
So, first of all, she did have Botox, and it's not the best Botox job because you can see her brow is arched. It's become too much of a Spock brow.
And one's higher than the other.
And one's higher than the other. And this is most likely from Botox. Now, if she came to me, I would need 1 unit of Botox to bring her brow back into position to equal the other side. So before she did this photo shoot, somebody should have done that for her.
What about her eyes? They look so much more open, don't
So
they?
her eyes are more open, but part of it's her brow position.
Right.
Her
okay,
brow's
it's
higher.
lifting it.
It's lifting up and creating more of a platform for the upper eyelid. But I don't necessarily think she had eyelid surgery. The volume in her cheeks, again, she's much younger in one picture. She's still young in the second one. I don't think necessarily she had volume placed, but I think her lips have been enhanced. I think she had a touch of filler. You know, if you just look at the shape as well of the upper lip, I don't think that's just lipstick alone for her, but beautiful.
Well, her mother's a model, and her sister's a model. It runs in the family. They're all gorgeous.
Definitely agree.
I feel weird guessing what someone has done when they're 20.
Yeah.
It just feels wrong.
Well, let's look at somebody a little bit older.
Yes.
Who do you have
Who's next?
Meryl Streep is next. Kind of a little bit fuzzy, but you can tell that maybe her nose a little bit. And
Well, her nose is thinned out. You know, she has the 11 lines in the second picture. So, you know, did she have Botox? Not the pictures.
Maybe on the
not
forehead, but certainly not in the
Yeah.
11 lines.
And, you know, her lower lids are still kind of full afterwards with her smile. So I don't think she had any kind of eyelid surgery.
No.
I think her cheeks are the natural cheek. The only thing I would say, if you look at her lips, they are fuller with a smile, and they should thin out with a smile compared to her younger picture. And so she may have had a touch of lip filler.
But she's pretty
but she's
natural.
beautiful. Yeah.
She's gorgeous,
Pretty natural.
especially for her age.
Yeah.
The next celebrity is Carrie Underwood.
Oh, we're going younger again.
So we're
Oh,
going
yes.
back and forth a little
No,
bit.
But still, for someone young, now I don't know if you know that she had a serious accident last year.
She did.
She fell and got cut and had between 50 and 70 stitches.
Wow.
Yeah.
So whoever did her surgery did a remarkable job, because in photographs anyways, you don't see the scars. This might be prior to.
I think this is prior to. And, you know, if you look at her brows come down. I mean, if she's doing Botox, she's doing it preventive. I mean, there's no necessary reason as far as lines are concerned for her. Her nose, we're looking at a different angle.
Correct.
And so, really hard to say. But I don't think she necessarily did anything about her nose. I don't think she necessarily had filler. Her lip with the smile, if we look from one to the other, I don't think she necessarily did anything with her lip. I think she's just beautiful.
And young.
Just naturally
Yeah.
gorgeous.
And a lot of these photographs are, we used to call it airbrushed. Now it's photoshopped. So they have a way, I mean, I even have an app on my phone where you can smooth out the skin,
Airbrush.
remove lines.
Well,
so some of these, it's not so much surgery as
well, that's
Photoshop.
become a little bit of an obsession, almost a problem, is that people have their Snapchat filters, and they come in showing me their picture with the Snapchat filter, and I want to look like this. and so, you know, there are some things we can make a change with, but the false impression that these filters give make things very difficult for people of your generation.
It's back to that false expectations.
Yeah.
You know, we want to look like these beautiful women that we see in magazines, and maybe it's not meant for everybody to look like that, because they don't really look like that.
No, they don't. They have a lot of work, whether it be post-production work or work done
Or
by
just the way the makeup's applied and the
That's
lighting
true.
that's used in some of these photo shots.
Contouring.
Right.
You can make your nose
exactly.
look smaller with contour.
Exactly. So sometimes I'm not sure if it's surgery or makeup. We have someone else to look at, right?
Yes, so going back in time a little bit, we have Marilyn Monroe to finish off the series. I thought this would be a good one to choose.
And that was kind of, I don't know how much cosmetic surgery they were doing in the 50s and 60s.
So they were doing surgery at the time. Now, if you look at her dreamy eyes in the second picture, she's looking down. There's no real skin fold that's there. But if you look at the amount of fullness she has to her upper eyelid when she's younger, I think she probably did have eyelid surgery, even though this was in the 50s. And her brow position, you know, I can't see her hairline there.
Right.
But it is possible that she may have had her brow lifted. And at that time, they did a brow surgery that went from ear to ear, lifting up the entire scalp for her. So that is possible. But, you know,
her nose looks the same.
Nose looks the same.
And the lips,
and
I
I
don't
think
think they did filler in lips back then.
No.
According to some articles, it said that she did get her nose done. Who knows for sure?
Yeah, I mean, it turns up a little bit, but again, it could be positional too. It could be lighting as well.
Yeah.
But an icon nonetheless, and beautiful. And, you know, did she have something done? We'll never know 100%, but it's
Never
possible her upper eyelids, I think.
Yeah.
Well, the whole key is the name of our show, Accent Your Beauty. Whether it's with makeup, whether it's with facials, fillers, or full-on surgery, accent what you've been given. Everybody cannot be 100% gorgeous, but everybody can be more beautiful. And Dr. Berkowitz, that's a wrap for tonight, and we'll be back next week.
Doctor, my eyes have seen the years.